Hello, check my curls. This is Dr. Janelle OD, your eye care expert, and we're here for our Sunday edition of Eye Spa Talk, Tales from the Trenches. Today we're going to be talking about what is a dry eye evaluation and who is a candidate for a dry eye evaluation. So today I am in my office in our new location in Smyrna, and I'm going to actually demonstrate some of the new technology that we have in our office to help conduct our dry eye evaluations. But I want to back up just a little bit. For those of you who do not know, my name is Dr. Janelle OD, your eye care expert. I'm an expert optometrist and dry eye specialist. I'm the CEO and founder of Brilliant Eyes Vision Center and Premier Eye Spa. We were in Marietta for the last 10 years in West Cobb. We just recently relocated to Smyrna at the Shops at Belmont. I think it's just under a month. So we have really advanced our dry eye services and treatment options, and can't wait to show you what we have here. Hi, Trudy. So go ahead and share this episode. Sharing is caring. So go ahead and hit the share button on the bottom of your Facebook screen and start a watch party, because we're going to show you something very exciting today. And I have a special guest who is my patient for today. But first, let's back up. So, what is dry eye? Everybody may be wondering, what is dry eye? Is it a symptom? Is it a disease? What is dry eye? Well, dry eye is a form of ocular surface disease. So the key word is, it's a form of a disease that starts on the front surface of the eye. And if it's left untreated, it can lead to complications that could eventually result in reduction of vision or sight loss. So definitely, if you are suffering from symptoms that could be related to dry eye disease, you want to know, because you want to be treated, you want to be managed, and you want to be under the care of an eye doctor. I conducted a small survey with just some of my Facebook friends, followers, LinkedIn followers, just to find out how many people actually knew if dry eye was a disease. And if they knew, are they being treated? What are they doing to manage it? And what would stop them from being treated? So 60% of those people in that survey didn't realize dry eye was a disease. They just thought it was a symptom or something that you had to endure once you reached a certain age, that it wasn't a disease and it was just how your eyes eventually will become. And then there were some people who were self-treating, meaning they were going over the counter, trying to find things to either take orally or topically to relieve their symptoms, but none of them really had been addressed by an eye doctor or eye care professional to dive deep into the causes and figure out the root issue that's making their eyes uncomfortable. And then most people said that there wouldn't really be a lot of reasons why they wouldn't get treated. Only mainly cost, or basically the number one reason was they didn't realize it was a disease. So dry eye is a form of ocular surface disease. It's what we call multifactorial, meaning it's not one set thing that can lead or catapult your symptoms into a full-fledged disease. So some are medication, some are age, some are gender. If you spend a lot of time on a computer, device, or tablet, some are systemic conditions like lupus, thyroid conditions, diabetes. Some come from medication. It's a number of things that can have you go from that symptom range to the disease. And usually if it's under the disease range, it's because something in the front part of the eye is not functioning properly. And that's what this new technology is going to be able to help us find out, what the underlying cause is for your ocular surface disease. This technology is called a Keratograph 5, and it's really awesome because it allows me to be able to conduct a dry eye evaluation and consultation without anything that may be uncertain. So before this technology, we had to base our diagnosis just on symptoms, right? So that means sometimes I would just throw the kitchen sink at you and see what would stick and say, oh, okay, that made it better. Let's try this. So now we don't have to kind of go around in a circle. We can customize a treatment plan specifically for the patient. I am speaking to the other optometrists out here who may be listening to this episode. Don't feel like this is a piece of equipment that you have to start off with. I implemented my dry eye spa back in 2018, and I did not have this equipment. Pretty much everything that's on here, except for imaging the oil glands, you can do manually. So it's important to do things manually and understand what you're doing. So then when you get the technology and you're able to delegate some of those things, that you still have a clear understanding of the disease process. So this will be more like you're extending or growing your dry eye spot. But don't feel like you have to start off with this, because I didn't, okay? But it has made my life a lot easier, and even my staff can appreciate this. And then patients like to see what is going on with their eyes. So we're going to get started. We're going to go through some of the dry eye imaging and diagnostic testing that we do here in our facility to figure out the underlying or the root cause of your ocular surface disease. And it's going to let me know if the ocular surface disease is dry eye disease, if it's oil gland dysfunction, is it that your eyes are dry because you're not producing enough tears, or if your eyes are dry and diseased because your tears are not sticking long enough, or if you have an underlying corneal dystrophy or disease. It's going to help me be able to determine all of that. And we're able to do it painlessly, pretty easily, in about 10 to 15 minutes. And I can delegate it to a team member. And then the patient and I can sit down and go through each scan and help customize a treatment plan. So we're going to turn it around so we can see who our patient is today. We have somebody debuting online. This person is not a social media person, so to get him in here to do this today is amazing. But we have here, where can we find it? Let's see. Come on in, don't be shy. Come and wave. There we go. So that's my husband. So he is going to be sitting as my patient on a Sunday evening. But he actually has some dry eye issues. He's the person that when he goes outside and it's windy, his eyes tear. So that's usually a hallmark for some potential ocular surface issues. When you go outside, if it's windy or if you're under air conditioning, all of a sudden your eyes start to tear. Also, his eyes are always red, particularly just at the end of the day if he spends a lot of time on the computer. And then sometimes he will flat out say that his eyes feel dry or uncomfortable. So we're going to do some testing today to see if we can figure out what the underlying cause is for his ocular surface disease. So we see here, I want to kind of scan and show you the equipment here. So the main thing is this machine here is going to do all the imaging. You see that the patient is going to put their chin here, forehead here. Basically, there's nothing that hurts, but there are some times we have to keep your eyes open wide. We may have to put some dyes in, which we'll go over a little bit. And then we have this big screen here that's going to capture all the images. And then this will allow me to be able to go over the images with you once we get some data. There are a gamut of images and tests that we can do. So we're not going to run through all of these today. On average, if you were to schedule a dry eye evaluation and consultation, the evaluation portion would take about maybe 15 to 20 minutes. And then the last 10 minutes is the consultation part. Oh, somebody say hi. Don't be shy. All right, so we're going to put some sanitizer on my hands here. And I'm probably going to end up dimming the lights. So that way, let's see how dark it gets. All right, cool. So you can still see pretty good. All right, so usually my technician is doing all of this. So I'm going to go ahead and put my gloves on so that they're already on. And so I'm going to instruct my hubby to put his chin in the chin rest. Chin in the chin rest. And then your forehead is going to stay propped against that bar. And then there's going to be different instructions that we're going to give you. Some of them, the red dot will be directly in the center. Some of them won't. Some of the time we will have you blinking and holding your blink. So just kind of pay attention to the instructions. So first, we're going to figure out if he's producing enough tears. If you don't have enough tears, then it's going to be really hard to keep your eyes hydrated. So let's see here. Okay, good. All right, so you're gonna look right in there. Let's see if we can get you lined up here. All right, you're just gonna keep looking in there. I'm gonna come in a little bit closer. I'm gonna turn this around so you guys can see what I'm seeing. You can keep the other eye open if you like, but I'm gonna try to focus on. Oh, good. All right, just blink for me. Now open wide. Hold your blink. Good. So we're measuring the amount of tears in his eyes. All right, so nice big blink for me. Good. All right, now hold your eyes open wide. Don't blink. Good. Good. All right. So now we're going to see, we've measured his tears. The next thing we're going to do is we're going to see how long the tears stay on the front part of the eye. So this is the really cool part, or sometimes it's a little bit challenging for patients, but this is what we call our staring game. So I'm going to instruct him to blink twice, and then he's going to hold it and try not to blink for as long as he can. And this machine is measuring how long the tears actually stays on the front part of his eye. They're supposed to stay there for a certain time frame, and if they don't, then there's no way your eyes are going to really stay moist and hydrated. All right, so let's try it here. We're going to move in. Okay, yeah, just follow that chin rest down there for me. All right, try to hold nice and still for me. Okay, so blink. Blink again. Blink 2 times. Now hold it, don't blink. Try to hold it as long as you can. The goal is to hold it for at least, there we go, at least 10 seconds. All right, and so what it's going to do is going to map out how quickly the tears started to go from the front part of the eye. And we're just going to take a picture here. We're going to move over to the other eye. We're going to do the same thing. All right. So once I get you lined up, blink twice. Now hold it, don't blink. You're doing good. So you see he was able to hold the blink longer. Go ahead and sit back for a second on the right side. So what we're going to do is we're going to jump down a little bit. There's some other aspects of this that are really cool that I want to get to. So another part of the dry eye evaluation is screening for any signs of inflammation. So the doctor would usually put some diagnostic dyes in your eye to image. So we're checking for inflammation. We're checking for signs of abrasions on the front part of the eye. So all my optometrists that are listening in, you guys know what these dyes are. Just because you have this machine, the dye doesn't go away. And before I had this machine, this is pretty much what I would use. This dye, manual expression, symptoms of the patient, which we still use now. But this is allowing me to kind of delegate and get imaging so that I could come in. Patients, this doesn't hurt. When we put this in, this usually doesn't sting. Now, sometimes depending on how irritated your eyes are, it may sting a little bit, but in most cases it doesn't. So what we're going to do for my hubby here, I want to really focus on staining for signs of inflammation, as well as looking at the what we call the oil glands. So the line of marks is going to let us know if there's any inflammation on those oil glands. So I'm going to put just the green dye in for him today. But typically when you have the evaluation, you have a green and a yellow dye that my medical assistant will put in. In most cases, I will not be the one running this testing. I have certified medical assistants that work here, and they're usually running the testing. They get all the information, and then you and I as the patient, will go over the results and formulate your treatment plan. So let's go ahead here. So typically, I usually put this in with just a little bit of saline, and I'm going to put Mr. Jimmy to work. Are you able to reach that over there? Either one, the saline. Yep, grab that one. Yep. So usually we just put a little drop of saline here so that way we can put that tear in. And I have some tissue there for you, Mr. Jimmy. Mr. Bay. All right, come on in. Look up some. All right, let's have you look up. There we go. And so for about 10 seconds, this will make your tears yellow. Green. It's in there. Go ahead and dab your eyes. Just dab your eyes. It will make your tears green. It doesn't stay. It usually drains through. And did that hurt at all, Jimmy?
Not at all.
Did it sting?
Nope, did not sting at all.
Did not sting at all. Don't be shy. Speak up. All right, so you'll put your chin back in there for me. So usually there's a few other tests that are done, but I'm going to jump down so that you guys can see what if there's any signs of inflammation on the front part of his eye, okay? So we're going to take some pictures. So we're going to actually start here with the right eye. Okay. Can you see that there? Yeah. All right, open your eyes wide for me. Is your forehead against the bar? Okay, good. And we can already see, I want to see if you guys can see that here. We're going to take some photos, but I've already can see where this green dye is adhering. Good. Try to hold your head nice and still for me. We're going to move out, get that a little bit more focus. And then we're going to snap a picture. And then, so now you're going to look towards this ear. Look towards that ear. Good. And so there's different angles of the white part of the eye that we're taking pictures. Open a little bit wider, but look towards that ear. There we go. Okay, good. Now you're going to look up. And I'm going to try to pull down your lower lid here. This is a beautiful picture. Can you guys see that? All right. So you're going to look towards this wall here for me. Look straight ahead first. Let me find your eye. There we go. Is your head straight in here? There we go. Make sure you're straight. Perfect. Oh, there we go. There's his eye. All right, so now you're going to move your eyes only towards this wall here. There we go. Good. Your eyes only to the other wall. Good. And now you're going to look up. I'm trying to pull down your lid here. Just look up. Good. And so the last thing I'm going to do that's really cool, this is what is, to me, the coolest aspect of this machine. So Jim, you can sit back for a second because I'm going to talk to the eye squad out here. If you guys have any questions, go ahead and put them in the comment. I'll be able to see them and answer them. We have Jennifer here. We have Christy, Dr. Christy watching. Hey, Dr. Christy. So this right here is called my biography. And this is really awesome because this allows me to get an image of his oil glands. So prior to this technology being out, we didn't have a way of imaging your oil glands, right? We could take a picture of them, but we couldn't actually image them to see if they're functioning properly. The important part about finding out early what's causing your ocular surface disease, looking at the structures, is the oil glands. Because the oil glands, they are very important with allowing your eyes to be hydrated. The oil glands do exactly what they say. They make oil. The oil is needed to mix with the tears that are already being produced and to make a coating to cover your eyeball. And I call that coating with my patients your eyeball lotion. You need eyeball lotion. So anybody that's on here that's listening, that's of color or got dry skin, if you don't have good lotion in the winter and it's too thin, it's not thick enough, it doesn't have enough oil base to stick to your skin, by the time you get out the house, your skin is cracking, it's irritated. And if you of color, we say it's ashy. You're ashy. So in the wintertime, you automatically know to go get a thicker lotion. Okay, you want a thicker lotion. So take that and think about your eye. If your oil that is in your eye is too thin, it's not thick enough to mix with the water to give you that perfect oil and water mixture, it's not going to stick. So, and then if it's not functioning properly for extended period of time, they degenerate, right? And once they degenerate, this is a part of the eye that does not regenerate. So if we don't know early on that this is the issue or that you are at risk for this, when you get older, you may have glands that have completely degenerated, and now you're suffering from these ocular surface issues. And once they're gone, we can't bring them back. So it's really hard to allow you to have the comfort that you need. So we're going to image Jimmy's oil glands. I'm going to put the camera on the big screen. I'm going to image the glands, and then we'll see how his glands look, okay? We've already saw how many tears he has, and I'm going to show you guys how we assess that. But now we're going to image those glands. So for imaging the glands, I would say this is the part of the dry eye evaluation that may be uncomfortable. It doesn't hurt. We have to flip your lid. So when you image the top lid, to see the gland, you have to flip the lid. Most boys, men, they've done this on themselves, so it's not big of a deal. And then we just pull down on the lower lid. So I would say it doesn't hurt. It just feels weird because it's like fleshy tissue, and you can like feel it on your eye. And then because we have to hold it open and image it, it may get a little bit dry. But I would say that's the part of the exam that is maybe the least comfortable. So I'm going to wave to some people here. How you guys doing? We got people joining. All right, so let's image Jimmy's glands. So what you think? Y'all think he got glands? Think they're shriveled up or not working? We got 100% glands working?
No.
He said he doesn't think he has 100% glands working. So let's see here, okay? So the first thing we're going to do is we're going to image the upper glands. So to do the upper gland, usually I have you come on in. We're going to pull this all the way back. So your chin's going to be in the chin rest here. I'm going to make sure you are up good. And we usually instruct the patient to look down. So I'm going to turn the camera so when I flip it, you guys can see. And then we'll begin to image. So let's see here. That's a good image there. All right. So let's have you look down, Jimmy. And usually use the Q-tip. Look down. Don't squeeze. Good. Don't squeeze. You can see there we have his gland flip, and he actually has like a little piece of hair on his gland. All right, so we're going to go do the other eye. So we're going to do the other eye. So you'll look down. Now, did that hurt?
Not that much.
Did it feel weird? Oh, you said not that much?
No, you have a soft touch.
You ask a man for anything, they're always going to say it hurts. That's why they don't have babies. All right, look down. All right, so we got that flipped pretty easily. Don't squeeze. All right, good. Now we're going to go back. And we need to capture I want to do the lower lid as well. So we're going to go over. Let's have you look up. Just keep looking up for me. I want to do the lower on the other eye, and then we're going to do some assessment. All right, look up for me. right, perfect. You survived, Jimmy. You can sit back. And so once the session is over, the cool part, somebody say, yes, he has glands. He has them, but they're struggling. We're going to show you guys in a minute. They're struggling, and he actually has a couple things going on that I was already able to see prior to starting the assessment. So usually this part will be done by my medical assistant, and then I'll come in, and then the assessment will start. And the assessment is the part that's going to help us determine what is going on and what we can do. So usually what I do is I spin this machine around so that when we start the assessment, the patient can see as well. Here we go. Yeah. All right. So we're starting the assessment, and this is the part of the exam that helps us understand what's going on. So we start the assessment here. We haven't done all the tests just because it would take up a lot of time. But I wanted to give you guys an idea of the ones that really kind of give us an idea as to what's going on. So the first one that we did, if you remember, we measured how many tears that he was making. So we have to go in and we have to actually measure how many tears that he's making. And so we usually measure about right here. And this part is tricky. We usually measure in a couple areas, and you can see I'm making like this, actually this, where you see this water. Let's see if we can bring you in a little bit. There's like a line that you see, and you can see it looks like a little river or water. Those are the tears, and then it measures them, and it lets us know if he's normal, mild, moderate, or severe as to the levels. So far it looks like his left eye, he has a good amount of tears in that lake. You want to at least anywhere from 0.35 to 0.26 amount of tears that will put you in a normal range. Okay, so let's go back to the right eye here. So that was the right eye, sorry. Now let's see here. Left eye, you can see that initially that tear lake in the most central part of the lake is less than normal, but he has it over here. Yeah, so it tells us that his left eye, it's mild, his right eye is normal. So that means he's producing tears, right, in both eyes. He's just not producing enough of the tears in the left eye. And so next we're going to skip down to the tear breakup time. Let's see, can you guys see this? So this machine, let's bring you out, is actually showing us how long he's able to hold his blink. And this here's the left eye. And what you don't want to see is these yellow and orange areas popping up. That means even though he's holding his tears, his eyes open, and he's minimizing his blink, these pockets are where the tears are evaporating. So not only he doesn't have enough tears in the left eye, but they're evaporating pretty quickly. And so his what we call a tear breakup time is not really normal. All right, so let's go to the other eye here. If I could figure out how to get, oh, here we go. Sorry, I lied to y'all. That was his right eye. So left eye is pretty good. He didn't have any areas where he had breakup pretty quickly. This eye is just not making a lot of tears. And then next we're going to jump down to these oil glands that we looked at. And we're going to grade them, okay? Can y'all see that? So Jimmy said that looked nasty. Well, that's your eye. So we're going to grade the right eye upper lid. So we flipped the upper lid, and the image is okay. It's a little blurry. But we're going to look down at the scale here. So I'm going to move you guys in so that you can see. It gives us a normal scale of tears all the way to an abnormal. Let's see if we can get that in there. So all the way down here, you see how there's no glands. And then all the way down here, there's a bunch of white little channels. This is good. This is normal. You want a bunch of white channels. That means those glands are functioning and doing what they're supposed to do. You have a high chance of keeping your eyes hydrated. But if you go all the way down here where it's like nothing, and you just see these little curly cues at the bottom, that's not good. So we don't want to get there. A lot of patients that have discomfort, they're usually somewhere in this range where their glands are not functioning properly and they've already started to degenerate. And once those glands are gone, we can't bring them back. So luckily, the top lid, Jimmy doesn't have any degeneration. Now let's see, let's go get his bottom lid. I'm going to grade his bottom lid. So the same thing. So on the bottom lid, for the most part, things are good, right? It's the same thing. This over here, there's no glands, have glands here. So he's doing pretty good. So glands are there. They're not completely degenerated. Sorry. We probably need to boost them. We probably need to make sure that the oil is to the capacity that it needs to be and that it's coming out at the frequency that it should when he blinks. And then we're going to look at his other eye here, top lid. So still pretty normal there as well. And then we're going to go look at the other eye bottom lid. Those are just like capillaries. It's not really black. It's just our images. So good news with Jimmy, his oil glands are not completely degenerated. So with Jimmy, what I would probably do is in that left eye treatment that I would do for him is that we would want to make sure that he is producing enough tears and that his tears doesn't have any inflammation in them, and that way allows them to stick longer. So what we would do, number one, we'll probably start him on a prescription dry eye medication, and in conjunction with that, more than likely I will enroll him into our dry eye treatment program, which allows us to use a special thermal heating process to make sure that these glands are functioning like they should, okay? If the glands are there, which they are, then that means they're probably clogged. That's why the tears are not staying as long as they should. So we have a special thermal heating process that doesn't hurt. It's not invasive. It's actually pretty chill, very comfortable, but it allows us to heat the oil back up in those glands to the capacity of like an olive oil, okay? If he has any parts of that gland where the oil looks like a stick of butter or lard, then the oil is not going to be able to come out like it should. So we will enroll him in the treatment program to be able to work on those oil glands. And then part of the treatment program is that we give you home therapy, things that you can do at home to help keep the inflammation down, make sure those glands don't get clogged later on. So that's pretty much the gist of a dry eye evaluation, meaning we're digging to figure out the underlying cause of your ocular discomfort. And ocular discomfort is not necessarily normal, right? So if you get it here and there, or episodic means, you know, you were out fishing or you were somewhere where it was completely dry on the airplane and you get off and your eyes are dry, that's different than dealing with something every day. So I use the analogy of a headache. If you get a headache and you take Tylenol and it goes away, that's fine. But if you get a headache every single day and you're taking Tylenol every single day to deal with the headache, at some point you need to figure out what is the underlying cause of your headache. Same thing with the eye irritation. If your eyes are uncomfortable and you feel the need to put tears in your eyes every day, or have some patients say they want to take a cool towel to their eyes, or put tap water in their eyes to rinse them out to make them feel better. If you're doing that every day, then it means you need to figure out what the underlying cause is, because that discomfort is not normal, okay? So what we're probably going to do, I don't know how compliant this one is, but we're going to sign him up for our dry eye treatment program. We're going to get him started on a eye drop, and then we'll see. We'll check back maybe in a month or so to see how he's doing, see how his eyes are feeling. That's if he's compliant. You know, compliancy or being compliant is important. I can only help you if you want to help yourself, okay? So I'm Dr. Janelle OD, your eye care expert and dry eye specialist, the CEO and founder of Brain Eyes Vision Center and Premier Eye Spa. Today we demonstrated some high-tech high technology or high-tech technology, which is the Keratograph 5. And this is something that we've implemented into our dry eye facility. And it's going to help us be able to better understand why your eyes are uncomfortable. If you need a dry eye consultation evaluation, then call me. Schedule an appointment at 770-428-0414. Or you can go online and book an appointment. Go visit our website at BrainEyesVisionCenter.com to book an appointment, and we'll be able to help you figure out why your eyes are uncomfortable. If it's not you, but if it's a family member, then go ahead and refer them. We'll take care of them. And if there's any questions, great talk about dry eye. Okay, perfect. If there's any questions, you can put them in the chat. I'll come back and answer them later. Or you can email me if you don't want to put your questions at eyecare@drjanelleod.com, and I'll answer your questions there. Don't forget to share this with your family and friends. So, Jimmy, how bad was it?
No, not bad at all.
Not bad at all? It was doable? You survived?
Yeah. I might give you a good Google review.
He said he's going to give me a good Google review. Are you going to be compliant with your treatment?
Yeah, I'm sure you'll make sure I'm compliant.
Okay. So we'll get them started, and you guys enjoy the rest of your Sunday. Thanks. Bye.